strict rest after a concussion, and that's just garbage. It's super outdated. It's not helpful. We know that strict prolonged rest can worsen and prolong your symptoms. Hey there, I'm Dr. Mark. I'm a concussion specialist, and on this channel we talk about how to get over concussion, post-concussion, and get back to your work, your school, your sport, or your regular life. So let's get into it. We're going to talk about how to heal your concussion from home. Now, I know this sounds like it's going to be a step-by-step, A to Z, how to recover from your concussion kind of video, and it's not. This is going to be really quick. First of all, I don't even know what you look like. I don't know who you are. I don't know what your symptoms are. I don't know anything about your injury, so I cannot give you one-on-one medical advice. We just can't do that on social media. We're actually just going to cover sort of the foundational things that you can do that are good for everyone in concussion and post-concussion and are going to point you in the right direction, or you're going to start to move that needle in the right direction towards recovery. So we're going to go through symptom-limited activity, things that you should be eating, things that you should be drinking, how you should be breathing, how you should be sleeping. And then the last note is just to connect with someone like me, connect with a concussion specialist as soon as possible. Let's start with symptom-limited activity. So this is going to be one of the most important and sometimes most counterintuitive thing that you can do. And I say counterintuitive because when you Google and when you look, and far too many doctors are still recommending rest, strict rest after a concussion, and that's just garbage. It's super outdated. It's not helpful. We know that strict prolonged rest, cocoon therapy, hibernation, dark room therapy can worsen and prolong your symptoms, meaning you feel like crap for longer. That's just not helpful. So one of the things we can do is symptom limited activity. And what that means is your activity is limited by your symptoms. And you might be thinking, I already do that. Here's what we're going to do. We're actually going to flirt with our symptoms a little bit. We're not going to get crushed and demolished and glued to the couch by our symptoms, but we're going to kind of flirt a little bit and then back off, flirt a little bit and back off. And that's what symptom limited activity is. So if you scale your symptoms from 0 to 10, 0 is none, 10 is a dumpster fire, pick a number. Like I might feel like a 4. Cool. I can walk the dog. I can do the dishes. I can read a book. I can check emails. I can do whatever I want, as long as it's not going to give you another head impact or another concussion. I can do whatever I want as long as those symptoms don't flare more than 2 points. So I'm walking the dog and I go to a 5. That's okay. I'm walking the dog and I go to a 6. Maybe I want to slow down. No more than a 2-point flare, and that flare shouldn't last for more than an hour. If you do that, you've had what's considered a mild symptom flare, and that's totally acceptable and even recommended. So begin symptom limited activity. Begin kind of bumping up to that 2-point threshold and slowly build your tolerance until you're doing normal things symptom free. Next, let's talk about how to be eating. This one is actually really, really simple. Eat like your grandma told you to. Eat your veggies. Have lean protein, have healthy fats. First of all, there actually is no standard diet for concussion and post-concussion. The way that we have the Mediterranean diet and the DASH diet for heart disease and hypertension, the way we have ketogenic for for treatment-resistant epilepsy. We've got diets for things. We don't have a diet for concussion. What we do have is a diet that really makes concussion worse, and that is the Western diet, the standard American diet. Really, anything you can do to move away from that is going to help move the needle metabolically towards recovery. I like to use Precision Nutrition, their hand portion thing. So think about a palm-sized serving of protein, a cupped hand of carbs, a fist of veggies, and a thumb or like a tablespoon of fat. If that's every plate you make, great. Like you're moving towards recovery. Keeping it really simple. Eat your veggies, eat your lean proteins, eat your healthy fats. Try not to have too many fried things. Try not to have too many refined sugars. Eat the way you know you should, especially after a concussion. Next thing for diet, let's hydrate. It sounds really, really simple, but drink enough water. Aim for 2 to 3 liters of water per day. The standard recommendation for everyone is especially true in concussion. When we dehydrate non-concussed people, when we dehydrate like healthy people, you can be healthy and concussed, but when we control groups, if we dehydrate them, they feel concussed, particularly in the cognitive domains. They also don't have the best balance, and so they start to feel and perform concussed even when they're not concussed. Let's not be concussed and dehydrated. Next would be slow breathing. So this gets into sort of some of the fancy mechanisms of concussion. It has to do with CO2 tolerance. Slow down your breathing. We tend to breathe too much after concussion. We tend to get more sensitive to CO2, so we want to kind of blow it off. One of the things you can do to help autonomic regulation, blood flow, CO2 tolerance, psychological symptoms is just slow down your breathing. So I usually recommend like a 5-5, 5-second inhale, 5-second exhale, no breath holding, or a 4-6, 4-second inhale, 6-second exhale, no breath holding. Through the nose, I recommend that 10 minutes, a couple times a day. That's going to do way more for your recovery than you realize, just slowing the breath down. Like the last thing I'm going to recommend before telling you to visit someone like me is sleep hygiene. Make sure you're taking care of your sleep. So sleep is one of those things that gets disrupted in concussion in both directions. It can be really hard to sleep or you can be way too sleepy. One of the best things you can do is with your sleep hygiene, stick to a routine. And a lot of times I actually say anchor your morning wake up time and the bedtime will kind of fall into place. So pick a time before 10 a.m., get up, see some sunlight, eat some food, do your subsymptom exercise, do whatever you got to do in the morning to kind of tell your body it's daytime. As it starts to hit evening, in the northern latitudes, particularly this time of year, it's going to get dark early, but let's say around 7 o'clock, 8 o'clock, start to dim your lights, start to shut off your lights, make it dark inside, and have a good bedtime routine. You know you shouldn't be scrolling TikTok before bed. You know you shouldn't be watching a really stimulating like true crime show before bed. Let's just go to bed. 60 to 90 minutes, an hour to an hour and a half before bed. Screen should go away. Pick up a book, start to journal, meditate, do yoga, do that paced breathing, do things to actually wind down. And then stick to your wake up time. No matter what your night was like, stick to your wake up time. As far as naps throughout the day, keep them 20 to 30 minutes. Don't go over that. You don't want to start clearing adenosine. You don't want to do things that's going to mess up your nighttime of sleep. A 20 to 30 minute nap can do wonders. Bedtime routine, wake up at the same time. If you need a 20-minute nap, great. Do your bedtime routine, wake up at the same time. Do that repeatedly and you'll see your sleep start to come back and you'll see your recovery start to take off. The final note, you can do all this stuff, but unless you see a concussion specialist, someone who's trained in concussion and can go through the 5 symptom generators and can actually assess you from where are your symptoms coming from, why are you experiencing what you're experiencing, and build a rehab plan off that, and you're just going to be doing good lifestyle habits. But if you've got a vestibular deficit, we didn't really touch anything that's going to impact your vestibular system too much. If you've truly got like an autonomic issue, we need to get some exercise testing or tilt table testing or different things to figure out what's going on there. If you got some metabolic issues and we need to run labs, well, you need to see a doctor for that. Find a concussion specialist. One of the easiest ways is download the Concussion Tracker app. It's a free app. You can do neurocognitive testing, balance testing, and you can also find a clinic. You can find a complete concussions clinic near you, and that's going to ensure a certain standard level of care. You're going to see someone who knows what they're talking about in the concussion, post-concussion space. And so to wrap it up, let's move. Let's flirt with our symptoms. Don't go more than 2 points on a 10-point scale for more than 60 minutes. Hydrate, eat like your grandma told you to, breathe a little bit slower, stick to a good bedtime routine, and find a concussion specialist. That is how to heal your concussions from home. I'm Dr. Mark. I appreciate you watching. If you like this video, you might also like these.